Is getting ready to administer COVID vaccines to small children. We have reached out to Dr. Caesar with KRONon Health to hear more about the local impact, and he's joining us right now. So it's not necessarily set yet. We are still in the phase of it's not been announced. But what do we know right now about this latest step in fighting the pandemic?
Yeah, so thanks for having me on. I think, as you know, we've been awaiting the vaccine to be approved for children 5 and under in the U.S. Because we understand that, particularly with the Omicron variant, we're seeing a huge increase in kids who are infected and actually hospitalized from it relative to the other variants. And so Pfizer, has applied to the FDA for approval of its vaccine in kids, 6 months to 5 years of age. The data are actually fairly strong for kids who are 6 months to 2 years of age in preventing hospitalization and death. The data are a bit less strong in kids 2 years to 5 years of age with the vaccine, at least in the initial trials. But given the massive increase in infections and hospitalizations, I think the FDA is looking for a solution to the problem that's facing kids these days.
A little bit. As far as the data and the metrics, it's the 6 month to 2 years of age that it's not as strong. Is that what you're saying?
It's actually, frankly, more effective in that age group. So okay. Even the youngest of the kids who were tested with the vaccine in the initial trials had the best response.
And then, so therefore, the 2 to 5 year old is not as strong, but still not powerful.
Yeah. Exactly. So again, just to remind everyone, throughout this pandemic, we've had roughly 11 million kids who've been infected with coronavirus. In the past month, so in January alone, we saw about 2 million of those 11 million infections. So there's something about these variants, these new variants that are, impacting kids, infecting kids, and we're realizing that to really stop the pandemic, to get ahead of it, we have to address vaccination in those age groups, just like we're doing in other age groups. So, it's an important step for us to protect the country, to make sure that infection rates go down, which means that the number of variants that emerge that are then harmful to the rest of the population, the risk of those will go down as well.
So, Dr. Caesar, a lot of parents, guardians, families were very concerned. We still don't have a large number of people, kids 5 to 11, that got vaccinated. So we still have that as an issue. Now we're looking at rolling out the 6 month to under 5. What would you say to those parents who are still on the fence, still concerned, parents or guardians, that are concerned in regards to getting their child vaccinated with the COVID-19 vaccine?
Yeah, well, first of all, I'll say I know exactly what you're going through. So I'm an emergency medicine physician, also at KRONon Health. We have many of our own employees are parents. I have 3 kids. We're on the front lines of this. So I have kids in all age groups, frankly, with the vaccines. I have an 11-year-old, a 15-year-old, and an 18-year-old. And as the vaccines were authorized for each of those age groups, we quickly had our kids vaccinated. It did take some discussion. It wasn't necessarily, an immediate desire to get those kids vaccinated. But when you look at the data and you talk to your colleagues in the medical community, you realize that kids do die from coronavirus. So COVID does kill kids. And vaccines are the best ways of protecting them. So in the emergency department, when I'm intubating or taking care of patients who are infected, I'll tell you that they come in all ages. And with Omicron, we saw that those ages ended up, becoming younger and younger. And so for the parents who are hesitant about vaccines because they're worried about side effects or long-term effects, there's no data to tell you that this vaccine is dangerous in your kids. There's a lot of data to show you that this infection is dangerous for your kids. So weighing those risks and balances clearly supports that you go and get your kids vaccinated today.
And let's tackle this. For example, to share a personal story, one of my twins, 10 years old, in August got COVID, and the other 10-year-old got COVID as well. So they couldn't get vaccinated at the time. One got very, very sick and was so very scary. You know, she couldn't breathe, you know, fluid in her lungs, high fever, really scary, Delta, right? So does that mean that she has now got this immune system so that she can't get Omicron? Does that mean that she doesn't need to get vaccinated? Now, what would you say to a parent about that?
That's such a great question. Thank you for asking it. And I'm so sorry to hear, you know, about your personal experience and your kids' experience with this infection, because I know how scary it is to see your kids having a hard time breathing. We actually have data now. So we're 2 years into this pandemic, and every day we have more and more evidence for what's effective to protect your family. The most effective thing is having your kids vaccinated and then boosted if they're eligible. And if they, on top of that, have had an infection, and if they've had an infection with the vaccine, that would be a mild infection. So if they've had the infection, they're vaccinated and boosted, they actually have the lowest risk of becoming ill from COVID in the future with additional variants. So we know that for certain now. So there are published data with over, you know, hundreds of thousands of participants where we can see how synergistic the vaccine plus infection is compared to infection alone. So if they were only infected and not vaccinated, they're still at higher risk of getting very ill from another variant of coronavirus. But with the vaccine, they get the most protection.
Now, what about, I've had these conversations, and thank you for that, and she did get vaccinated and seems in great spirits now, but that was a really scary thing to go through, especially, you know, 3 o'clock in the morning and she's frantic. Right. And, you know, spewing on me, of course. So that all said, coming with Omicron, there have been lots of children that have gotten Omicron. Can they get it again? Even though they're vaccinated, can this just keep on going?
They can get it again, but again, the subsequent infections, particularly if they're vaccinated, will be much more mild. So of the patients who I see in the emergency department, those are ones who are sick enough to go to the emergency department, and a small set of them are sick enough to be admitted to the hospital. I'll tell you anecdotally that nearly all of them have been unvaccinated, the ones who are requiring oxygen, requiring a ventilator. For patients who are vaccinated, they can get infected for sure, but the infections are much more mild than for patients without the vaccine. And so again, going back to this idea that sure, the vaccines won't protect you from getting infected, but it will protect you from getting, you know, deathly ill from it, which is really what we care about. We want to make sure that your family is safe, that you're safe. We also want to make sure that the health system stays safe. So think about the number of people who are going into hospitals, overwhelming them, and frankly, preventing others from having beds in the emergency department. And we're seeing that strain throughout the Bay Area.
And the last question, I want to kind of circle back to the beginning of the interview about this new age bracket. Do we know when it could be announced? Where is it in the process? We understand what Pfizer has done, but now it needs to go through the step-by-step, right? CDC, the Western Conference, all of those things. So can you kind of dial down with bullet points in regards to what happens next, and what do you think is the trajectory as far as when it could actually be that this age bracket now can get vaccinated?
Yeah, so, you know, we're really relying on the White House, CDC, FDA for guidance on timing. I think the best guess is that it'll be over a month away. The initial steps would be, again, data analysis, and then a subgroup within the FDA will analyze those data and then decide whether to recommend to the larger group at the FDA to provide emergency use authorization for the vaccine. That all takes, oh yeah.
My apologies, doctor. I also wanted to, there was some talk about this like 3-shot regimen. What do we know about that?
So are you talking about for kids under
Yeah, for
age
kids.
5?
Yeah.
Yeah, we know that the doses are different for this age group. So roughly 3 micrograms of or microliters of the vaccine for that age group. That's about a tenth of what it is in adults, depending on again which vaccine you're looking at. And so I think the FDA is looking at data around all the different variations of administering the dose response, et cetera. So I think that largely remains in the hands of the FDA to really guide us on what the appropriate dose is.
Okay, well, so much to I feel like I could continue to talk to you for a very long time, but a very important subject. It really seems that we're moving forward. It's kind of a slow train right now as far as waiting for the White House, but certainly another good step forward in regards to fighting this pandemic and hopefully putting all of this behind us, sort of, right?
We're hoping, yeah.
Fingers crossed. Thank you very much, Doctor. Appreciate it.